Yeah, we're still friends. We're competitors, but we're still friends. And this is a Kodak moment because we're all sitting together.
It was a friendly forum of healthcare industry managers, senators, and GovGuam officials who began what will clearly be a lengthy process of trying to figure out just what parts of the Affordable Health Care Act apply to Guam and how much it will cost us. Netcare Plan Administrator Jerry Crisostomo.
There are 92 provisions in the Affordable Care Act, and 59 of those have been implemented since September 2010 through current month. And despite the ruling, I think it doesn't change any of our business strategy to fully come into compliance with the Affordable Care Act, all the provisions.
But there is uncertainty over whether the entire act applies to Guam or not. In particular, the individual mandate, which requires everyone to get health insurance or pay a penalty. That is the key question. The Supreme Court last Thursday ruled that the individual mandate is a tax, and since Guam mirrors the U.S. tax code, the mandate would apply here. But if it does, it could cost GovGuam up to $70 million annually. That's because many island residents wouldn't be able to afford a health insurance plan, and as a result would be pushed into Medicaid coverage requiring matching funds from GovGuam. Public Health's Medicaid Administrator Tess Archangel.
The problem is Medicaid is 55-45. Where am I going to get that 45% local match to increase the number of eligibles under the Medicaid program in order to decrease the uninsured population of Guam?
On the other hand, the individual mandate may not apply to Guam. The Obama administration disputes the Supreme Court's characterization of the mandate as a tax, calling it a penalty. If the U.S. Department of Health and Human Services rules that it is a penalty and not a tax, no mandate applies. No worries about an extra $70 million. But the island's health insurers are united. The mandate requiring everyone to get coverage must apply, or they risk going out of business.
We don't know if we're going to be around if the mandate doesn't apply, and we support the individual mandate because it provides that balance between the provisions and requirements that we have to comply with, and that mandate that gives us that additional revenue to survive. We are a business. We're not a welfare agency, as a lot of doctors think we are.
The bottom line for the private health insurers on Guam is it's all or nothing. The private sector needs Obamacare's individual mandate to stay in business, but GovGuam can't afford it. Kevin Kerrigan, PNC News.